Hi, my name is Dr. Amir. Are you suffering from recurrent episodes of difficulty breathing or wheezing from time to time? Do you sometimes wake up at night with similar symptoms? Is your activity limited because you get difficulty breathing during exercise? All these symptoms could be related to asthma. Asthma is a chronic disease of the lungs. It is recurrent attacks of wheezing due to temporary narrowing and blockage in the airways that leads to the lungs. This is because of the presence of spasms and secretions inside them. These asthma attacks can be triggered by a lot of things, which can cause allergy in certain people, like dust, molds, pollens, smoke, or perfumes. Also furry animals, cockroaches, and dust mites, or even chemical in the air, like pesticides or the smell of paint. In some cases, changes in the weather or taking some medications like aspirin can also cause an attack. The asthma attack is a frightening experience to the patient, but fortunately, it gets resolved quickly with treatment, and the breathing goes back to normal until the next attack. So how do patients feel during the attack? Typically, they feel tightness in the chest, unable to breathe easily with the wheezing sound. Other patients might complain of a chronic cough only. Usually, symptoms get worse at night and in the morning, also after exercise or exposure to cold air. Most of the time, the cause of asthma is genetic, especially if it starts at younger age, before 12 years old. In fact, there is no specific test to diagnose asthma, but we rely only on the history of the recurrent attacks as well as the presence of the family history of asthma. What about the treatment? The best treatment for asthma is to prevent it by avoiding the triggers. But in case the attacks is very severe, it might need treatment in the emergency room. For mild attacks, patients know how to treat it with nebulizers or inhalers, which contain medications to dilate the airways and relieve the attack. Another important part in the treatment is to take medications to prevent these attacks, either by taking a daily pill or by using an inhaler which has a combination of cortisone and medications to keep the airways dilated. Nowadays, cortisone inhaler is considered the cornerstone in the treatment of asthma attacks, as well as the prevention of future attacks. But people might get concerned about the side effects of cortisone. In fact, it is considered very safe when taken by inhalers. Here is my advice. First, patients should take their medications regularly to prevent future attacks. Second, they should avoid the triggers, especially smoking, and to take the flu vaccine every year. Finally, it is important to avoid catching COVID-19 as it might cause a serious pneumonia infection. I hope you enjoyed my topic today. If you do, please like, share, and subscribe to my YouTube channel. Until I see you again, I would like to wish you a happy, healthy life.